So the question is, which statement is true regarding the following condition? You can see the picture clearly, and the option are A, clinical crown is more than anatomical crown, clinical crown less than anatomical crown, clinical crown equal to anatomical crown, and the D option is clinical and anatomical crown are not related to each other. Okay, so you have to understand what is clinical crown. Okay, anatomic crown is a portion of a tooth covered by enamel, remember. Okay, and what is anatomic root is a portion of the tooth covered by cementum. Okay, so this is anatomic crown and anatomic root. So what is clinical crown? How much it can be visible by clinical crowns means part of the tooth that has been denuded of its gingiva and project into the oral cavity. And what is clinical root is a portion of the tooth covered by periodontal tissue. Okay, so here basically we can see that clinical crown is more than anatomical crown, so the right answer is option A. Now the next question is, what is the main important feature of these fibers? Okay, so the option are A, prevent extrusion of tooth, B, largest group of fibers, C, reconstructed even after destruction of alveolar bone, and D, resist lateral tooth movement. So you can see in the image, what is this fibers? These fibers we call transeptal fibers. These are the gingival group of fibers. Okay, so what are the properties of this? The property is option C is the right answer. The properties of transeptal fiber is reconstructed even after destruction of alveolar bone. So C is the right answer. Now coming to the next question, what is the main etiological factor of such type of defect? So you can see the defect clearly visible in this image. So let's see the options. Options A is vigorous tooth brushing, option B is prominent root contours, and C periodontitis, and D all of the above. And the answer is prominent root contours. Option B is the right answer. Why it is the right answer? Because it is a case of fenestration. What is fenestration? Fenestration is in which the root is denuded of bone and the root surface is covered only by periosteum and overlying gingiva are termed as fenestration. So this is the case of fenestration. In this instance, the marginal bone is intact, remember. And what are the causes of fenestration? If you know the causes of fenestration, you can easily solve this question. So there are mainly three causes are main. The first one is prominent root contours. If there is prominent root contours, we can see the fenestration. If there is malposition of a tooth, may cause fenestration. And if there is labial protrusion of the root combined with the thin bony plate, these are some predisposing factors which can cause fenestration. So remember, the answer is prominent root contours. Now coming to the next question. Identify the following that is used to collect GCF. Okay, GCF is gingival clavicular fluid, and the option is paper, pH paper, absorbing paper strips, litmus paper, and none of the above. The answer is, if you can see the picture clearly, the answer is absorbing paper strip. Okay, so this can be remembered by you. There is nothing explanation. Okay, now the next question is, in a 17-year-old patient who is undergoing orthodontic treatment, which is the most common gingival diseases seen? So if we see the options, there is marginal gingivitis, periodontal abscess, ulcerative gingivitis, and aggressive periodontitis. So obviously the answer is marginal gingivitis, because we know that in ortho patient there is a plaque accumulation is very common, so that may cause marginal gingivitis very easily. So the option A is the right answer. Now coming to the next question, which bone defect is shown below? Okay, so if you remember which bone defect is this, there is option is horizontal bone defect, angular bone defect, exostosis, and buttressing bone defect. So the answer is angular bone defect. If you remember, angular bone defect are 1 wall, 2 wall, 3 wall, right? So this the option B is the right answer. Question is, what is the probable diagnosis in a 45-year-old male patient with poor oral hygiene and pocket depth of 5 mm or more. So there are options are aggressive periodontitis, refractory periodontitis, marginal gingivitis, generalized chronic periodontitis. So if we see the age of patient, 45-year-old male patient, okay, and there is poor oral hygiene, there is pocket formation, so obviously this is a case of generalized chronic periodontitis. So option D is the right answer. Now coming to the next question. Next question is, in a 40-year-old male HIV positive patient, so HIV positive, you can remember the following condition may be due to. So there is option Candida albicans, Campylobacter, fusiform spirochete complex, and there is option D, Streptococcus pyogenes. The answer is very simple. Option C is the right answer, fusiform spirochete complex. Okay, now coming to the next question. Identify the following instrument we can use very on a daily basis in our life. So what is this instrument? This instrument is option C, it is a neighbor probe. Why we use? To detect furcation, okay. So neighbor probe, this is a neighbor probe. Now coming to the next question, what is the indication of the following instrument? Okay, this is a periodontal probe. If you can not remember by this, you can remember WHO probe, right? Because there is a marking. So this is a periodontal probe. Now what is the function of periodontal probe? The option is detect furcation involvement. No, that is done by neighbor's probe. Option B is determine width of attached gingiva. No. Option C, detection of pocket around implants. Yes, there is use of pocket detection around implants or around tooth also, right? So option C is the right answer. Now coming to the next question, what is the use of following diagnostic kit? Okay, so this diagnostic kit, if we zoom that, here is a perioscan. Okay, now the perioscan, why we use perioscan? To identify bacterial profiles. So there is option is cytofluorography, latex agglutination, phase contrast microscopy, and identify bacterial profiles. So the answer is option D, identify bacterial profiles. Now the coming to the next question, it's very important question. Identify the disease in a 16-year-old male patient having autosomal recessive character with following clinical findings. So there are options A, Down syndrome, option B, lazy leukocyte syndrome, option C, papillon-Lefer syndrome, and the option D is Chedick-Higashi syndrome. So papillon-Lefer syndrome is a condition of this. So option C is the right answer, because there is a 16-year-old male patient, and also this condition, PLS syndrome, is a autosomal recessive. So that's why we go with option C. So option C is the right answer. Now coming back, question is, in a 17-year-old female patient, the most common initiative factor for gingival diseases is. So there is materia alba, calculus, dental plaque, pellicle. So the right answer is of course dental calculus, because there is, we can see calculus, there is an answer of dental plaque. So sorry, dental plaque is a main causative agent of this condition. So we go with the option C is the right answer. Now the next question is, a 12-year-old male patient having oral temperature of 102 degree Fahrenheit and following clinical condition. It's a very important question. So a 12-year-old male patient and oral temperature is 102 degree Fahrenheit. Now what is the main causative agent of this? So herpes simplex virus, option B is herpes zoster, option C is Borrelia vincenti, and D is spirochetes. So the right answer is herpes simplex virus. Okay, so there is fever also, there is age also, so we go with the option C, herpes simplex virus. Now the next question related to with the same, which are characteristic cells found in this condition? So there are option A is hyaline cells, option B is Downey cells, option C is Zhang cells, and option D is host cells. So the right answer is Zhang cells. We can easily find Zhang cells in herpes simplex virus infection. Now the next question is, how much time does this lesion take to subside? So generally herpes simplex virus took 7 to 10 days take to subside. So basically option C is the right answer. And the next question is, what is the dose of antibiotic given for this condition? So acyclovir is the most commonly drug we prescribe, but the right dose is 15 mg per kg for 7 days. So option A is the right answer. And the next question is, what is herpetic white low? And there are option is herpetic infection of skin, herpetic infection of lips, herpetic infection of clinician fingers, all of the above. So herpetic white low, the right answer is herpetic infection of clinician